So the way we perform liposuction is to make some very small incisions in carefully selected areas. Those incisions are usually about just the length of my fingernail. And so we will make a very small incision after numbing it up with some local anesthesia. And then we start the process by infusing a solution into the area, which we call a tumescent solution. And this tumescent solution decreases pain and blood loss. I like to use a technique called SAFE lipo, capital S-A-F-E. And that stands for separation, aspiration, and fat equalization. And so when I'm performing a liposuction procedure, again, we start by putting in that tumescent solution. And then I take what we call a cannula, which is the instrument we use to remove the fat, which is essentially a long wand with an opening at the end of it. And I go in with a larger cannula that is not on suction at the time, and I'm using that to separate the fat from the surrounding tissues. I then switch to a smaller cannula with a smaller hole and opening at the end, and then I turn on the suction and I go into the area where I've separated the fat and I aspirate or remove the fat from underneath the skin. I now go back in with the first cannula I used, which was the larger one that was used in the separation phase, and I go back in and I use that to smooth everything out that's been left behind and perform the fat equalization phase. This technique is a wonderful liposuction technique because it really allows us to remove large volumes of fat from each area being treated, but leave a nice smooth contour when we're done.